Welcome to another episode of Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. Today we continue our series, Decades of Face. The title of today's episode is Decades of Face, the 30s, the Prevention Decade. We are back with another episode in our Decades of Face series. In the first episode, I was fascinated to hear about how many different things could be treated in the 20s decade and about how much variation really occurs. But now we're moving on to the 30s. Why are we calling it the Prevention Decade?
This is a decade when most people still look young, but small signs of aging are showing almost universally at some point over the decade. That means that this is the time when it is essential to start working on skin maintenance to prevent aging changes or at least slow the rate of change in the skin from young metabolically active skin to thinner, older, slower metabolizing skin. So we don't want to let things snowball. We want to prevent an accumulation of changes.
What are some of these changes that begin to emerge in the 30s?
As skin begins to age, it becomes thinner. And this is especially true in fair-skinned people who have thinner skin to start with. Two of the biggest preventable factors in skin aging are sun exposure and smoking. We also start to have a change in our features, though, not just our skin quality. And this begins volume loss in the face, which at first is probably a good thing, but eventually is a little bit of a bad thing. So we may have our best face in terms of shape at some point in the 30s, but as we continue to lose volume in the face, we've lost that baby face of being in our 20s, which is a good thing. We look a little more sculpted. But then as that becomes too much of a good thing, we start to hollow and deepen and see a number of things that are early signs of aging. So the 11s, those vertical lines in between the eyebrows, crow's feet, or lines out at the corner of the eye, and sometimes dimpling in the chin will begin to show in our 30s. Also, the nasolabial fold will deepen, and I'll share my thoughts on chasing the nasolabial fold. I mean, it's natural to have a fold in between the cheek and the upper lip. Even when we're 15 or 20 years old, there's a fold there. But in our 30s, particularly the latter half of the 30s, that fold starts to get deeper and craggier, and that's not a good thing. So to the extent that it's deepened, we should probably restore it. Some people only want to boost the cheek to affect the nasolabial fold, and I think that's a mistake. I think you need to do a little bit in multiple places rather than a lot in one place. But we don't have to efface or eliminate the nasolabial fold because that's a natural shape even in a youthful face. On the other hand, the marionette line area, the line from the corner of the mouth down to the jawline, is not a line that we see in a youthful face. And if that makes its appearance at some point in the 30s, we always want to chase that because that is always a sign of aging. In addition to those lines, sometimes we see the beginning of flattening or creasing in the cheek and the beginning of hollowing in the temples. That's less common in the 30s, somewhat variable, but it can be seen at this juncture.
Okay, so now that we have a broad overview of the aging changes in our 30s, let's talk about typical treatments in this decade. What kind of beauty plan should I start considering?
So things like Botox or other neuromodulator treatments to chase some of these dynamic lines in the forehead, the crow's feet, the 11s, that's something that very commonly is included in beauty plans for people in their 30s. And filler treatments, if some of these other lines or shapes are starting to really come out of their youthful configuration, we can start chasing those using injectable fillers. If the skin is looking thinner, parched, starting to get a rough texture, chemical peeling, and a variety of energy-based treatments with lasers or radiofrequency devices, microneedling, or even microneedling with PRP, platelet-rich plasma, all these things can help restore and maintain the quality of the skin if the skin is starting to look older. But before we get to in-office treatments, it's always going to be using a couple of really good home skincare products. So that almost always in the 30s starts out with a retinoid, retinol, retin-A, or a similar product, or a growth factor-based product. Some people will use the very inexpensive products like the glycolic acid products. And all of these things exfoliate, increase skin turnover rate, and so as skin is getting a little metabolically slower, it's a way of goosing the skin and getting it to perk up a little bit and work a little harder at staying youthful.
Let's discuss surgery for a moment. What are the surgeries that often happen in the 30s?
So if we look at the American Society of Plastic Surgeons 2020 statistics, which is the current most recent statistics available from that society, they show the surgical procedures in the 30s focused on things like breast augmentation and liposuction, as well as breast reduction. And the other really big item, which is the face procedure, is still rhinoplasty. We talked about rhinoplasty being probably one of the most common face surgeries in people in their 20s, and that's still true of people in their 30s. In smaller numbers, you'll see things like breast lifts, tummy tucks, and that sort of thing. A lot of that relates to body changes after childbirth, but if we look at things on the face, it's rhinoplasty, which is an extension of that perfection decade of the 20s. And sometimes people might have liked to have done it in their 20s, but they didn't have the disposable income to do it, or they just became more aware of how it impacted their appearance in their 30s. And so things like rhinoplasty and cheek implants still play a role. And we're starting to see eyelid surgery become a surgery on folks in their 30s because the lids typically start to show aging changes in most people to a greater or lesser degree in the second half of their 30s.
Let's go back to non-surgical treatments for a moment. For those of us who want to turn back the clock but would prefer not to undergo surgery just yet, what options are available?
So the 30s are when Botox and fillers become really, really big. So for Botox, it's more than 10 times as many people in their 30s receiving Botox treatments as people in their 20s. It's actually almost 15 times. And 5 times as many people are getting fillers. Now, that's probably because filler use is fairly common in the 20s because people are getting lip filler or lip augmentation. But fill of other areas on the face for aging changes really starts to kick in the 30s. We also see a big uptick in the numbers of laser resurfacing, chemical peels, and microdermabrasion for skin quality improvement, and doubtless other energy treatments that are not well captured by these statistics in the survey.
Lastly, before we conclude, Dr. Bass, what are some important takeaways that our listeners should remember from this episode?
The really important takeaway message is that the 30s are a decade when skincare and skin treatments are essential to avoid starting down the pathway of looking obviously older, and important to delay that process for as long as possible. There's a lot of variation in how old the skin looks in people who are in their 30s, and so your baseline skin quality and how much treatment is needed given how the skin looks, and your personal desires about how much treatment you're willing to put yourself through at this stage of the game varies a lot, individual to individual. But always remember, doing something is way better than doing nothing at this stage. When it comes to the face, we're still largely in a non-surgical arena, except for face perfecting procedures, but there are not a lot of anti-aging surgeries in the 30s, with the exception of eyelidplasty, which really starts to play a bigger role, typically in the second half of the 30s for many people. Finally, face volume restoration and dynamic wrinkle treatments with basically injectable fillers and with neuromodulators like Botox are the mainline in-office treatments, and they're widely utilized to great benefit by people in their 30s. So this is still the sweet spot of when you can look nearly perfect, get maximum benefit from treatments, and a lot of responsiveness from your skin if you do go ahead and do a treatment.
Well, after today's episode, I certainly see the importance of being proactive when it comes to skin maintenance and preventative treatments. After all, we can never completely stop the aging process, but we can do our very best to get ahead of it. As always, thank you, Dr. Bass, for sharing your knowledge and expertise with us and giving us some useful advice on how we can age gracefully through our 30s. And thank you to our listeners for joining us today to learn about how having a beauty plan in your 30s can go a long way in delaying the aging process. If you think of other exciting developments or trends in plastic surgery that you would like us to discuss in upcoming episodes, please reach out via email or Instagram. We'll see you next time. This is Doreen Wu, thanking you for joining Dr. Bass and me for this discussion of aging prevention in your 30s and the steps we can take to slow down the aging process. Be sure to tune in next time, and don't forget to subscribe to our podcast to stay up to date with all of the exciting content that is coming your way.
Thank you for joining us in this episode of the Park Avenue Plastic Surgery Class podcast with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The commentary in this podcast represents opinion. This podcast does not present medical advice, but rather general information about plastic surgery that does not necessarily relate to the specific conditions of any individual patient. No doctor-patient relationship is established by listening to or participating in this podcast. Consult your physician to advise you about your individual healthcare. If you enjoyed this episode, please share it with your friends, and be sure to subscribe to our podcast on Apple Podcasts, Google, Spotify, Stitcher, or wherever you listen to podcasts.